Okay, so we're going to go through cough assist and essentially how to set up the machine, just to reinforce and support the information that's in the respiratory information book. Obviously some of you will be a little bit unfamiliar with using it, but hopefully this will give you some information so you know at least how to put it together, and give you a bit more confidence if you actually need to use it with a patient. So this is our cough assist machine. It's a nippy clear way. So this is what we have in the trust. We just have one of them and it's kept up on intensive care. Just before you get round to surgical high dependency, there is a cupboard on the left hand side, and it's kept at the far end of that cupboard, in our clear way bag. So it's just in there so that you can carry it around to wherever you need it, and then it just needs to come back after you finish with it, so that we know where it is at all points in time. Unfortunately, the machine doesn't have a battery pack, so you do have to plug it in at the wall and obviously switch the power supply on, and then that goes directly into the back of the machine. Once it's all plugged in, you can turn it on. Just make sure the machine is on a firm, stable surface. If it's on the patient's bed and it falls off, then that's £3,500. So please don't break the machine. The machine will always come on in the settings that you last used, so if you're using it for the same patient on repeat sessions, then that's really helpful. But if you're using it for multiple patients, you will need to remember to change the settings. So to set it up, it's quite straightforward. We have circuit tubing, so there's only one type of tubing that we use, and it looks like this. The way that we know that we've got the right tubing is we've got a purple exhalation valve on it. There are normally circuits up on critical care. If they're not, they live down in the therapy department, where we keep all the sticks, frames, crutches, etc. Just let one of the respiratory guys know if we run out. So we also need a filter in order to protect the machine and protect the patient. At the moment with coronavirus, the recommendation is that we use 2 filters on the machine. So I'll show you how to set it up with a filter at the machine and at the patient end. So normally, inside the circuit, you will only get 1 filter and then your tubing, and then you need to go and get either a mouthpiece or a mask, and then your additional filter out of the ICU cupboard. So once you've got all the bits that you need, so 1 filter goes directly onto the machine. You attach that in there, and this extra port needs to go in just on the left hand side. It works as part of the feedback loop for the machine, so that it can sense patient effort and pressure levels. Then this bit is already together. You pop your filter on the end so that this filter is in between the mask or mouthpiece and the exhalation valve. So basically when your patient is coughing into the mask or mouthpiece, whatever they have sort of from a respiratory point of view, it's not going to then go aerosolized into the atmosphere. Mask or mouthpiece just depends on your patient really. If there is somebody that can, hold it themselves and are quite compass mentis and can follow instructions, mouthpiece is probably easiest. There are some mouthpieces in with the bag normally, but if there's not, they'll be in the intensive care cupboard, and they're labelled as mouthpieces that we use for Entonox, up on the top right hand side. The masks come in 3 different sizes, so they come in size 3, 4 and 5. Most adults I find need a size 5 mask, so that's an orange ring. Sometimes we don't always have those masks in stock. Size 4 normally works okay. You just have to sort of squash it on their face a little bit, and if it's a child that you're using it with, a size 3 mask would be better. So you just pop it on the end. Okay, so that's your circuit all set up. The only other thing that you can do if you want is attach the hand control. See, the other control is here. Some people find it a bit difficult to reach that and hold the mask on the patient's face. So having the hand control means that you can hold the mask and do the control at the same time, and then you're nice and close to your patient and you can see what's going on. So it goes into the back of the machine. There's only one way that it can go in, and then you just have to screw it in tight on the little dials. The hand set is slightly temperamental. If you kink the wire too much, it won't work. So just be mindful of what angle that you have the machine at. Sometimes you have to turn it away from yourself in order for the hand control to work. At some point we will get that fixed, I hope. So I'll talk you through the settings. It is quite straightforward to use, especially if you're used to using phones and other gadgets and things. It is quite straightforward. Mode. We typically use everything in manual. There are a few patients that we would use a program timed auto. Those are for the kind of patients that we've treated a few times. You know, they've got a nice settled respiratory rate, and we would select you know, how many breaths in they're going to do before they do a cough. That's probably for people that are a bit more au fait with the cough assist machine. So for most people, just make sure that it's on manual control. If it's not on manual, then all you have to do is use the up and down key here, and then just click set for when you're on manual, and it will tell you here that you're in manual. So then the only things that you need to change are your insufflation and exsufflation pressure. All of the information about what pressures we select and why and what we go up to is all inside the respiratory information booklet. But in order to change the settings, you press the button corresponding to what you want to change, press your up and down keys, and then once you're happy with what you have set, just click set to confirm that setting. You do the same on the exsufflation side, and then when you want to actually use the machine with a patient, all you have to do then is use your hand control. Just wait for it to be a little bit quieter. So you can hear that it's quite noisy, so you know that it's working when it makes that noise. If it's not making that noise, then it's because the machine isn't working, and maybe you just want to try it on the control down here instead to get your in breath and to get your out breath. You don't have to press the start stop button. That doesn't do anything on this mode. It's on the other modes that becomes more essential. So when you want to turn the machine off, you press the power button, and then you press the power button again, and it will turn itself off. If you unplug it before you turn it off, it will make a horrible noise. It will stop making that horrible noise after a few moments. But other than that, that is kind of the basics of what you need to know about how to put the circuit together, and how to adjust the basic settings, and then how we actually apply that to the patient is all in the respiratory book. Hopefully that's helpful. If it's not, let me know. And that's all I have to say.